And we're live. So it's May 8th. And this is Senate Health and Welfare. Good morning. And we're going over S-192 with some proposed revisions from the House Human Services Committee. Katie, why don't you put the
Sure. Here.
summary section by section up? And if anyone wants a hard copy. Yeah, get it.
So good morning, Katie
Good
McLean,
morning.
Arkansas Legislative Council. There is not an integrated version of the as passed House version yet. There were 3 committees that made committee reports, so that's 3 documents, and then there were 2 floor amendments. So it's a lot to integrate. So instead I have a section by section summary of what the House did that integrates all those pieces. So this reflects what the as passed version will look like.
Can I just ask, the 3 committees were Human Services, Judiciary,
And healthcare.
and Healthcare, okay.
The jurisdiction is split upstairs, so Human Services has jurisdiction over the intellectual disability population, and healthcare has jurisdiction over the mental health care.
And Judiciary, it's Judiciary.
So before we even look at this, it's maybe important to step back and just talk about the changes that were made sort of at a high level. So to refresh your memory of what you passed, there was a discussion about the creation of a forensic facility. That would be a facility in which criminally justice involved individuals with mental illness or intellectual disability, and to have or demonstrate a high level of violence. It was a potential placement if they were committed to the Commissioner of Mental Health or the Commissioner of Dale. When it went upstairs, it went to Human Services first. And the conversation there was that that committee had decided that individuals with intellectual disability should not be placed in a forensic facility, and they wanted to continue seeing community-based placements. So that decision was made in Human Services, and they stripped out the language on forensic facility.
I want to just,
Yep.
I'm gonna go to your question in just a second, but to clarify, the people who we had suggest would go to a secure forensic facility were people who had committed a serious crime, which would have, and were incompetent to stand trial, and that the crime itself might have a life sentence.
So alleged to have committed a crime because they hadn't been tried yet. They might have been incompetent to stand trial, or they may have been adjudicated not guilty by
Not
reason of
guilty by
insanity.
reason of insanity. That doesn't hold for someone with IDD necessarily.
It could potentially, because remember, we have the incompetent to stand trial standard, or adjudicated not guilty by reason of insanity is a legal standard,
Right.
whereas to be committed is a clinical standard. So those 2 things are distinct.
Thank you. Okay, Senator Weeks.
So I just want to make sure that you may have clarified it already, but the intellectual disability, the carve out or the separation of that group from by the other committee. Again, it still applies to folks who have created a violent crime, et cetera. It's not, it's just separate, it's just recognizing that their recognition of that group should not be
In forensic.
in a forensic facility, but in a community setting.
In a community setting, and they added language at the end of their bill that asks the department to propose what a secure community setting, like a one-on-one or 2-on-1 type placement would look like if the department wants to, so they.
Another question.
Yeah.
But the courts could decide to remit them to incarceration prior to adjudication, or if they can't stand trial, could they still be in jail? Unless.
If they've been committed to the Commissioner of Dale, then they are going to have a placement outside of a correctional facility because they need a clinical placement. If they're not committed to the placement, if they're not meeting that statutory standard of having a medical clinical need, and they're adjudicated not guilty by reason of insanity, then they cannot be held in a correctional facility.
Right.
So they'd be in the community.
Okay, so this is all about the difference between a secure forensic facility or a secure community setting for people in that situation. That's what the house is put them all out into the community. And so
So they would be in the commissioner's custody, so they'd have to be in a placement. And then the committee bill is asking for a closer look at what those type of placements would look like in the community. If the department wants to do something different than what they're doing now.
okay,
There's also in the intellectual disability language, you made some changes to just generally what commitment looks like separate and apart from a forensic facility. And they kept most of those changes, they reorganized a bit, but a lot of the changes to commitment, like going from an indeterminate period from 90-day period, those types of things were retained, so we can look at that more closely.
okay.
So I'm gonna keep marching along my
I
time.
know you don't have much time,
It's
so
okay,
go ahead.
I want to give you an overview. So that decision was made in Human Services, and then the bill went down the hall to healthcare to look at the population of individuals with mental illness. The conversation in that committee was, if there's only going to be one population in a forensic facility, do we still want a facility at all? And they had some conversations, a lot of conversations with the Department of Mental Health, and asked, is there still a need for a forensic facility, or can you accomplish what you're trying to accomplish in the secure residential recovery facility?
Like Riverview.
Yeah.
Or Valley,
River Valley.
River Valley.
And so, the department's response was that if they could administer involuntary medication at the secure residential recovery facility and use emergency involuntary procedures, which is seclusion, restraint, both physical restraint and medical medication restraint, chemical restraint, then they could do what they wanted. They could do what they need to at the secure residential recovery facility. And there's testimony that that facility was not currently full. So at that point, the healthcare committee decided not to move forward with a forensic facility, and instead to expand the types of interventions that would be available at a secure residential recovery facility. So they decided to move forward with allowing the EIPs, emergency involuntary procedures, and involuntary medication at the secure residential recovery facility. I'll pause there.
You said that's Woodford,
River Valley.
River Valley?
River Valley in Essex, it used to be, it's on the site of where the youth stabilization facility was.
But it's a new, right? It's fairly new in the past couple of years, right?
Huh?
Isn't it the one that was just built?
Yes.
Yeah.
I know we want Katie to get quicker testimony, so we can save the answer to this question till the end, but didn't the study group think about this as an option, and if so, why wasn't it?
Well,
But-
the study group did not think of it as an option because the administration was very firm on having a secure forensic facility, and we had looked at that last year. So we spent all of last year looking at some of this stuff. And then we put in the Act 27 working group as a result of our work on S90, I think it was. And so then all summer and fall, we met weekly. And now the recommendations that we put into bill, our proposed bill, have been changed. I will say that in the capital bill came up with a recommendation for design for a secure forensic facility. So now we've got this stuff going on, and that is affirmed in the big bill. So that's where we are. Good question.
Okay,
Go
we're
ahead.
gonna keep going.
Please.
So separate and apart from the discussion on the secure residential recovery facility, in the budget, there was a request from the administration and approval for a psychiatric residential treatment facility for youth. if that sounds familiar. However, that's a new level of care that has no structure around it in terms of like licensure, how does a facility like that get licensed? Who can go there? So, the healthcare committee added language to create a licensing process for that type of facility. And also, you'll see if we have a chance to go through it, that there are a lot of like rights and protections that attach to individuals in the commissioner's custody, particularly with regard to hospitalization. And this proposal would extend that to residents of a secure residential recovery facility and a psychiatric residential treatment facility for youth. So you'll see there's a lot of sort of conforming language around extending
Define secure
protection.
residential recovery facility.
There's a definition in statute.
Okay, well, okay, but they put that in.
They moved it. It had already been in statute and they moved it elsewhere.
Okay.
Yep.
And then what you're talking about for the licensure process is only for youth
It's for the,
facilities.
it's for the, yes.
Okay.
Right. Shall we go through the section by
There's a lot
section summary?
They took our bill. It's more fun. Yeah.
Okay. So, section 1 is your purpose and legislative intent. Specifies that the purpose of the act is to enable the Commissioner of Mental Health to seek initial treatment for individuals at a secure residential recovery facility and to seek treatment for youth at I'm calling it a PRTF. One important thing that I forgot to mention about the secure residential recovery facility, right now, in current law, you can only go to a secure residential recovery facility if you are coming off a prior order of hospitalization. So you have to have gone to a hospital level of commitment first before you can be on an order of non-hospitalization at a secure residential recovery facility. So this bill changes that so that a person can go directly into an ONH and a secure residential recovery facility. So that's an important distinction, that there doesn't have to be an initial order. Your initial order could be at the secure residential recovery facility.
I'm gonna save all my questions.
I'm happy to give them a.
No, I think, because, yeah, there's a lot. Let's go through it.
Okay, and then it also updates the civil commitment procedures for individuals with intellectual disability. First, we're in title, so we have the mental illness portion of the bill first, if you remember that. Title 13 is the criminal justice title. We modify language, existing language authorizing the commitment for an indeterminate period and changing that to a period of up to 90 days to be consistent with Title 18. And it also provides a victim with the right to submit a victim impact statement to the family division. That was a decision this committee had made, and that was remains in the bill. Section 3, now we have moved to Title 18. This is the civil commitment portion of the mental health commitment statutes. The definition section adds a definition of department and the PRTF, and it also moves and modifies the definition of secure residential recovery, because currently in secure residential recovery facility is sort of embedded in one section of statute, but now it's being referred to more broadly, so it's been moved up to the definition section to apply to the whole part of Title 18 that pertains to mental illness. And it's been modified because previously it said somebody has to go to an OH before an ONH, order of hospitalization, prior to an order of non-hospitalization at a secure residential facility, and that has changed. Next, here's.
Never mind.
Do you have?
No.
Okay, I'm happy to take questions if you have them. Next is one of our conforming changes. There is a existing section of law called the Clinical Resource Management and Oversight, and it adds the PRTF to the list of facilities to which patients are entitled access to a mental health patient representative.
Patient recovery and treatment facility, what is the P?
Psychiatric residential treatment facility
Thank you.
for youth, yeah. It saved me a lot of typing to use the abbreviation. Appreciate patience on that, okay, section 5, system of care, this adds the PRTF as an element to the mental health system of care, there's existing. Section of law that lists all the different elements of the system of care, and that has been added. Reporting requirements. Act 79 from 2012 asks for a big annual report from the Department of Mental Health. The report currently goes to Human Services, not to healthcare, so because that's how the jurisdiction was of the committees when the report was requested, it was mental health was in Human Services. So that has been changed to be healthcare. There is also separate and apart from this annual report, an annual report on involuntary medication. And so the committee chose to repeal that separate report on involuntary medication and move the reporting requirements into this larger annual report on the mental health system of care. And they've added a new reporting requirement regarding individuals in the commissioner's custody who are unable to move to a less restrictive setting due to lack of alternative placement. So they want that information collected in the annual report. Section 7, another sort of conforming change. There is existing section of law on reportable adverse events. And it adds the PRTF to the list of facilities that must report an adverse event to the department. Similarly, section 7A is another sort of conforming section. It requires the Department of Mental Health to provide notice of any reportable adverse events to the mental health care ombudsman. Okay, section 8, this is our new, creating a new section specific to the PRTF. This is the licensing section. So it prohibits a person or governmental entity from establishing a PRTF without obtaining a license from the health department. It directs the health department to issue a license if it determines that the applicant and the proposed PRTF adhere to the following standards. The applicant has to be a nonprofit entity and have demonstrated the capacity to operate a PRTF in accordance with health department rules and in a manner that ensures person-centered care and resident dignity. Applicants have maintained certification from CMS. They have an accreditation from the Joint Commission. The applicant has demonstrated that the PRTF complies with the health, safety, and sanitation standards. The residents are under the care of a physician. Applicant has a clear process for responding to resident complaints. And the PRTF is subject to inspection by Dale, who is the survey certification for CMS. So they would be the ones doing the inspection. This specifies that a PRTF license is not transferable or assignable and can only be used for the premise named in the application. The PRTF is to be among the placement options for somebody who's the caring custody of the commissioner. The testimony was that most of the residents would be voluntary, but this creates an avenue by which the commissioner could have somebody involuntarily placed on an order of non-hospitalization at the PRTF. This language directs the health department to adopt rules for carrying out the section, including rules about the emergency and voluntary procedures. And it also establishes a process by which the health department can deny, suspend, or revoke a license for a PRTF. Okay.
Go ahead.
Since you paused,
Yeah.
are there any, was there any testimony and actually any youth that fit this criteria?
There was testimony on the PRTF. They took quite a bit of testimony after the budget process, and during this bill. I think most of their testimony had been right after the budget process. I'm not always in the room, but yes.
There is no current facility for the youth of this category.
My understanding is a lot of the youth would be sent out of state right now.
Yeah, or all going out of state. We're working on trying to have a facility like this. This part of the bill seems like it might be helpful to what the needs are in the state.
This is the facility that, the Virgin's facility, that, the one that they proposed for Virgin's.
So this is kind of a new thought, it's a new concept, well, not a new concept, but it's a new concept to the bill.
Yes.
It's a
Yes.
It's
totally-
new to the bill.
Yes.
Yeah, it is new to the
It
bill.
may have been a priority, but didn't reach the level of priority to get it into the current bill or the
Well,
religious.
the bill that we were working on came from the historical development of judicial concerns about people who have committed serious crimes. And this is coming from the other side of the world where kids don't have an adequate treatment facility in the States.
Fair, thank you.
Yeah, at the time, I mean, it was sort of funny, but just the timing and, because the request came as part of the governor's budget request, I believe.
Yes, it was.
But the House was working on that while you were working on this bill, so the pieces never exactly lined up,
Sure,
yeah.
you fill out.
Okay, I do have to leave in a few minutes, should I try to get through the mental health section
Yes.
and I can come
Well,
back?
Sure. Yeah, let's get through the mental health section and come
Okay.
back to the stuff.
So section 9 is, there's existing language on an application for voluntary admission. And there's language about youth admission, existing language. That voluntary admission to a hospital. And so this adds the PRTF as one of the voluntary options. Section 9A, more conforming language, there's existing language that discusses that residents or patients have to be treated with dignity and respect, and the secure residential and the PRTF are added to the list of residents that would be treated with dignity and respect. Section 9B has to do with transportation. Right now, it's this language is specific to hospitalization. But this would apply the same protections with regard to transporting somebody to residents of the secure residential and the PRTF. Application for involuntary treatment. So, you have looked at these statutes before with regard to the forensic facility. This would allow, the commissioner, when, seeking to have somebody committed to their custody, to have as a placement option the secure residential recovery facility or the PRTF on an initial order. So that is what is happening in section 10, that's the application. And section 11, the court is making the order, the court is making a decision that somebody could be placed in one of those.
And this family court?
Family division.
Yeah, okay.
Section 12 and 13, are similar, this is the application for continued treatment, so this is the court, or the commissioner seeing that a person that is in the commissioner's custody needs further treatment and needs to apply to the court to do that. So there is already the possibility in current law for a placement at the secure residential facility in this instance, but this layers on top of that, the PRTF. And then 13 is the court order. Section 14 is the application for voluntary medications. There are some changes in this section. Technically, right now, there's already statutory language that allows involuntary medication at the secure residential facility, even though they don't have the rules to allow for that. However, that section is being amended because it only applies to individuals who are first on an order of hospitalization and then in the secure residential recovery facility. So the language changes to say, to recognize that somebody could be at a secure residential recovery facility as their initial order, not necessarily an order of hospitalization. But the last three are conforming changes. So protocol, that's existing section, and it adds a secure residential recovery facility to DMH's protocol, ensuring health, safety, and respect for patients subject to involuntary medication. There's existing language requiring the posting, the notice of a patient's rights to be posted in the hospital, so that is being extended to individuals at the secure residential and PRTF. And then similarly with treatment, existing section that's being amended to add the secure residential and PRTF to the list of facilities where emergency and voluntary procedure data is collected by the department. And that is the first half of the bill.
Okay, so the second half is the Dale in the care, custody and habilitation of Dale and how that's handled. And the CRRF actually relates to that, is it?
To Dale, no.
Not at all.
No,
Okay, just want to
only
make sure that
individuals,
we're
no.
not crossing.
Although as the conversation came up yesterday, there, of course, could be somebody with a dual diagnosis.
Yeah,
But they are committed where their primary diagnosis is. So somebody with a primary diagnosis of mental illness would be committed to
okay.
the Commissioner of Dale.
So we are gonna have to put this on the schedule for tomorrow.
Okay, and if I can come back before 10, I will.
Good luck. I know, so thank you.
You're welcome.
Yeah, I know this is crunch time.
I know, it gives you a lot to talk about.
Yes, there is a lot to talk about. All right, so the committee, we were supposed to look at S98. Jen is not available to go through with us. We could look at it. Well, let's just take a little break